We're pleased to be joined by Peter Rosario, who is president and CEO of a great organization in Brick City, Newark, New Jersey. It is La Casa de Don Pedro. You'll see the website up. Peter, good to see you, my friend.
Great seeing you again, Steve. Thank you so much for having us.
You got it. While the website is up, tell everyone what La Casa is and why it's so significant, particularly for citizens in and around the city of Newark.
La Casa is essentially the largest Latinx-led agency in the state of New Jersey. Started as a place-based CDC in the lower Broadway neighborhood when we had a bunch of childcare moms joined with a community activist named Ramon Rivera. Found the agency in the wake of the riots and turbulent times.
Rebellion in 1967, and as a very young kid in Newark, I remember Ramon and the work that he did. So good, I'm sorry.
Yes, yeah. So exactly, and essentially, basically, fighting for the rights of a Latinx population then, and obviously with our Black brothers and sisters fighting to make Newark the best place to live, and that led to us being a multifaceted. One thing I would always say: there isn't a solution that we don't like to take on, right? So we do AIDS work, we do weatherization, we do early childhood education, we do after school enrichment program, we do mental health services, workforce development, welfare to work, those kinds of things.
And along those lines, Peter, you know that we're doing a series, an ongoing series for several years called Reimagine Childcare. And La Casa has been very involved in the childcare situation and the crisis, if you will, of affordable, accessible childcare. As we put up the Reimagine Childcare website, let me ask you, the impact of COVID on affordable, accessible, quality childcare. Peter Rosario, go ahead.
In a word, devastating. I think it can't be understated. We have a crisis in our state, and it's going to take a whole of government and philanthropy and the social sector, educational sector to rebuild it. We're lucky. I hate to say lucky that we're back up to 80% of enrollment, and we're probably one of the better ones in the city and in the state. And I think it's an ongoing situation. Wraparound services need to be reinstated and fully funded to make sure that parents have a full work day, not the school day. We know that for our youngest parents, 3 o'clock is just not enough. So I think, and I would say this, if you see a child care worker, you should thank them. If you have a child care worker, I've done this work for 25 years, did it in the heart of 9/11 in Flushing, Queens, when things were bad there. But this is the worst year that child care professionals have had throughout the state in terms of dealing with the issues with our youngest learners, in terms of equity, in terms of mental health, in terms of physical health and well-being. So I think we really, I know we always say, thank a firefighter, thank a nurse. Like, I think we got to put child care workers.
Thank a child care worker, professional.
Right, thank a child care worker.
Hey, Peter, try this. We've talked a lot about, we're well over 2 years into this pandemic in the spring and going to the summer of 2022. So I'm curious, La Casa has been very involved in promoting, advocating vaccines. What kind of progress have we made, A, particularly in communities of color, and B, how far behind are we even now?
That's a great question. I think 2 prongs to it. First, we should celebrate. This is by far the fairest and most equitable access to a vaccine that has ever happened in the history of this country, right?
They haven't always been fair and equitable, but go ahead.
Right, and that's the whole, right? I think we need to start with the positive, the headline. I think La Casa and agencies who had that boots on the ground, the trusted voice, really were the ones who had to build trust in the vaccine, because as we know, people of color, rightfully so, are very skeptical of vaccines. Our approach was a little bit different at La Casa, even for our employees. And I think if I had to put a stamp on what our success story was, we got to 95% vaccination rate of our staff without threatening to fire people. We had to put
How'd you do that, Peter? How'd you do that? You didn't make it mandatory. You didn't say we're going to fire you. How did you do that? How did you encourage and get those high numbers?
So I had to send out all the official notifications, right, for Head Start and when so I did those, but I also followed them up with, hey, we're going to work with you on this. We had staff meetings, we had town hall. I went one-on-one to meet with people. I can tell you, I had folks, I did a raffle that I gave out $1,000 gift cards to five of our staff, $500 gift cards to thank them. I could tell you that even after that, I had one of our staff who's said, I'm a firm anti-vaxxer. I do not believe this works, but you've respected us. You've treated us with dignity. You haven't vilified us. So I'm going to do this because I want to keep my job. And I believe in what La Casa is doing in terms of balancing the right approach. Was it perfect? No, but I think it really, this is one of those where we measured twice and cut once in terms of not firing people early on. And I think it paid off in terms of building trust. And again, my sentiment to the staff always is our staff, our colleagues are our first customers. So if we can't do this in a fair fashion with them, then how can we expect them to go out in the community and do it fairly?
Peter, I got about a minute left, and I'm going to open up Pandora's box here. But the issue of immigration, huge issue in our state, in our region, in our nation, particularly for an organization like La Casa, for the people you serve. Many of them are not legal citizens. They are just people in need, people in the community. To what degree has that situation been exacerbated through the pandemic?
Do I have to say devastating again? I think it's
You're the one doing the work, Peter, not me. You're doing it.
There are neighbors, there are friends, there are business owners. We have to get over the vilification of immigrants. This state, by and large, is one of the richest states in the country, if not the richest. And it is largely due to the immigrant population and making sure they feel welcome and on their labor. So everything we need to do, the excluded New Jerseyan funds, it needs to be extended. We need to add more money to that. We need to continue learning the lessons we learned in terms of food access and everything to support families and keep them going.
I'll let you go on this. How much is it still as challenging as it's always been, or even more so, to raise money to keep La Casa going? I know that we have to do it 24/7 here at the Caucus Education Corporation and in public broadcasting. Go ahead. No money, no mission. Go.
Yeah. I think we need to support the extraordinary support that people extended generosity for COVID. We need them to keep it going, right? We were blessed to have one-time donors. We hope they become sustaining donors. I think if you open your pocketbook a little extra for COVID, keep in mind that if you can keep that in your budget, we need to keep those funds going because now is the economic pandemic. That's what's starting now.
And the people that are disproportionate, listen, we've all been affected by COVID, but the reality is the people that La Casa serves are disproportionately affected. It's worse. It just is for a million reasons. Peter Rosario, President and CEO of La Casa de Don Pedro in Newark, New Jersey. Good to see you, Peter. Talk soon.
Thank you.
I'm Steve Adubato. That's Peter, and thank you so much for watching. We'll see you next time.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. If we want our children to be successful, we need to increase the investment in the people who care for them. It is time to build back better by reimagining the way we support these essential providers. Learn more about the Reimagine Childcare campaign by visiting the website at reimaginechildcare.org.
Also brought to you by Delta Dental of New Jersey. Everyone deserves a healthy smile. The Turrell Fund, supporting Reimagine Childcare. RWJ Barnabas Health. The North Ward Center. The Port Authority of New York and New Jersey, moving the region through air, land, rail, and sea. Choose New Jersey. The Healthcare Foundation of New Jersey. Community Food Bank of New Jersey. And by Prudential Financial.